my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. Also visit the playlist where the subjects are given in a very systematic order. In the last class we are discussing about one of the autism spectrum disorder, that is Asperger syndrome. The first part of the Asperger syndrome we have seen what are the common symptoms which are present there and what is the common presentation. Now to continue with the same, a Asperger syndrome, child with the Asperger syndrome, so they will always have a robotic type of talking. Okay, just like robotic. A robotic means there is expressionless and emotionless. So they are talking so many things, but when they are talking it is monotonous and also it is expressionless, emotionless. Okay, so this is one thing. That means a person who is listening to him, so he will be very easily get bored because these people are talking in the same tone without any expression and even with the less eye contact. So usually the person sitting in front of him will get bored by this. Another important thing in Asperger syndrome is they actually live a very happy life. The reason is, so they will be happy because they know everything. So they can appreciate what others are talking. Okay, and they even understand the joke. Okay, and they also understand all the chatting which is going in a group. But the problem is they themselves are not interacting. So they are the silent spectator there. Okay, so what happens is they usually live a very happy life. Okay, because as they are not commenting anywhere something like, so nobody is talking about them also and there is no joking on them. So usually they enjoy everything. Only problem is they are not giving any comments. Social interaction is poor, although they understand everything. Another one is when they are talking it is expressionless. Okay, so that make them isolate from the others in a group. When you are in the group, that makes them isolate, but otherwise they live a very happy life. There is no any problem. So this is one of the autism spectrum disorder. What is the main problem here? Yes, as I told earlier, the main problem is always the communication and interaction. Social developmental milestones are normal. It is developed in the normal time. But still, when it comes to the question of communication, so they will have problem in communication with another person. See, communication means it requires your tone, your body language, eye contact, okay, a change in your tone. Many things are required, emotions, many things are required. Now, they don't have all these things. So they are communicating just like a robot. Okay, so and interaction is quite less. That means if you ask one question, so they will only answer to the point. So suppose somebody is asking, what is your name? Then he will tell his name and he will keep quiet. Otherwise, what happens in a friend circle? If somebody is asking my name, in return I will also ask, what is your name please? Isn't it? So this fellow will not answer question like that. So he will answer to the point and then he will keep quiet. Most of them will have some problems related to other people in social and communication problem. Okay, so themselves they don't have any problem, but when the question of communication come, so it looks odd to somebody. For them there is no matter. For the others it looks little odd. Now if you are talking to a person while who is smiling, suppose I am giving the example, if you are talking to a person who is smiling, all of a sudden a smile in the face disappears and there will be frowning and you think something wrong with him. Now suppose you are talking to a Asperger syndrome child or person. Okay, so you are talking to that person with a beautiful smile in your face, but actually he also started with the smiling. Okay, he also started with smiling, but suddenly his smile disappears while talking and he is now frowning like this. Suddenly smile disappears, serious face and start frowning. Now you think something went wrong with this person. Nothing has went wrong with this person. It's the Asperger syndrome. So Asperger syndrome child or a person do like this. Suddenly he will change the expression to a expressionless face. Now, he started with a small smile and suddenly he changed the facial expression to a mask appearance. Okay, expressionless or something frowning like that. So this type of behavior is quite common in Asperger's. Okay. Another is a person with the Asperger syndrome, he never notice the same. Okay, for you it looks very odd, isn't it? A person who is smiling and talking, and suddenly he's changed the facial expression, and you start thinking, what happened to this man? Okay, but nothing has happened to that man. For him, is normal. He don't think that it's an odd behavior. For him, it looks normal. Okay, so they will have the problem with maintaining the non-verbal communicating skills. Okay, so even they have the problem with maintaining the non-verbal and non-verbal. Verbal, already they have got the problem. See, social communication can be done by verbal and non-verbal, isn't it? So verbal, already they have the problem in interaction, in formulating the words and all. Okay, even in the non-verbal also, okay, they have got the problem. Suppose if somebody is talking to you, although you are not able to talk with them, at least you go on keeping the smile, isn't it? You can keep a smile in your face. But this man will have problem in that also. Only for 1 or half an 30 seconds he will keep a smile. Then his facial expression will going to change. That means he has got the verbal and as well as non-verbal communication problem. So he is not worried does you are happy or unhappy, because that's what I'm telling. For him it is normal. Okay, he never think that it's an odd behavior. Okay, he is not worried does you are happy or unhappy, because for him it is normal. So therefore I told this is quite interesting disease. Now suppose if you go with another example, if there is a pretty beautiful rainbow in the sky, suppose, then you will feel beautiful and you will share it with your friends, joy with the others, isn't it? Somebody is seeing the rainbow, very beautiful, then it definitely will share this happy moment. But someone with the Asperger syndrome, what he will do is, he does not have the spontaneous desire to share something of interest or enjoyments. The Asperger's fellow is also looking at the rainbow, but he don't feel that this particular beautiful moment, happy moment, should be shared with the other body. He is others. He is individually, singly, he is enjoying that without any expression in his face. He is enjoying, but without any expression in his face. Okay, so they never show anywhere, they will never show that they are excited. Okay, it may be a very happy moment, but still by looking at their face you cannot appreciate that they are happy. Okay, so they never show that they are excited or happy. So this is one of the problem with the Asperger's syndrome. So we have got so many other interesting things in Asperger's syndrome. Okay, so although all the symptoms of Asperger's syndrome may not be seen in all the disorder, but in all the people with Asperger's syndrome, if you look into the society, okay, in your surrounding, you can find some of the single points in somebody. Okay, it may not be, you cannot get all the collectively all the points in a one person, but definitely by this time you would have been thinking that yes, that person will do like this only. Sometimes even I also do like this only. So this thinking will come in your mind. So this is quite interesting. We will continue in the next class. Thank you very much for being with me, and please don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.